Hello, I'm Sheila Davies, Director of the Dare County Department of Health and Human Services. The total COVID-19 positive case count in Dare County is 436, of which there are 21 active cases among residents of Dare County. 13 of the 21 residents are currently in Dare County. Of the 436 cases, 234 are residents and 202 are non-residents. Currently, there are 2 individuals, 1 resident and 1 non-resident, who are hospitalized out of the county. Since the last Dare County Department of Health and Human Services update issued Friday, August 21st, there have been 21 new positive cases. Of these 21 cases, 9 are residents and 12 are non-residents. The Dare County website has already been updated to reflect all of these cases. Of the 9 resident cases since Friday, August 21st, 7 of the 9 cases are college students. Only 2 of those cases are connected. 4 of the 7 are symptomatic, and 3 are asymptomatic. All 7 acquired the virus by direct contact with individuals who tested positive outside of Dare County. 1 case is symptomatic. It is unclear how this individual acquired the virus, which indicates community spread. 1 case is asymptomatic and acquired the virus from a family member whose positive test result was reported on 8/18. Of the 12 non-resident cases since Friday, August 21st, 1 case is symptomatic and acquired the virus by direct contact with an individual who tested positive outside of Dare County. 2 of the cases are not connected, both symptomatic, and both acquired the virus from family members who tested positive outside of Dare County. 2 of the cases are not connected. 1 is symptomatic and 1 is asymptomatic. It is unclear how these individuals acquired the virus, which indicates community spread. 4 of the cases are connected. All acquired the virus by direct contact with an individual who tested positive outside of Dare County. 3 of the cases are not connected. All are symptomatic and all acquired the virus by direct contact with individuals who tested positive outside of Dare County. Contact tracing has been completed on 16 of the 21 cases, and direct contacts provided by these individuals have been identified, notified, and directed to quarantine for 14 days from the last date of exposure with the positive case. The 14-day quarantine requirement is very important to slowing the spread of the virus, as the incubation period for the virus is 2 to 14 days. We are working with the other 5 individuals to identify direct contacts. While over the past 3 weeks we have seen relatively low numbers of new COVID-19 cases, less than 25 each week, it only takes a day like today for things to quickly change. Today we have had 12 new cases. The majority of today's new cases acquired the virus by direct contact. Close contact continues to be the predominant way the virus is being spread. This reaffirms how important it is for each of us to do our part and remain vigilant by following the 3 W's to help reduce the spread of COVID-19. Wear a cloth face covering if you will be with other people. Wait 6 feet apart and avoid close contact. And wash your hands often with soap and water for at least 20 seconds or use hand sanitizer. Each week we review the 4 key metrics associated with disease investigation and surveillance. The metrics are number of tests, confirmed cases, positive test as a % of total test, and COVID-like illness surveillance. This past week, there were 897 COVID-19 diagnostic tests performed in Dare County by local healthcare providers. This brings the total number of tests performed since early March to 10,238. There were 21 positive cases between August 17th and August 23rd. The % of positive tests to overall tests in Dare County since we started testing in early March decreased again this week for the 5th week in a row to 4.07%. The % positive to total tests for the past week alone was 2.34%. Syndromic surveillance of the emergency department and the urgent care centers showed a decrease in the number of individuals presenting with COVID-19 related symptoms this past week. These graphs can be found on the Dare County website at darenc.com/COVID-19. We encourage you to stay informed by visiting darenc.com/COVID-19 or by visiting the CDC or NCDHHS websites. If you have specific needs or questions, you may also call the Dare County COVID-19 call center Open Monday through Friday from 8:30 a.m. to 5 p.m. at 252-475-5008. Thank you.